You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, big topic, replacing missing teeth with dental implants. My first guest says that nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, Dr. Patrick Peters. Dr. Peters, welcome to the program.
Hey, Randy, thanks for having me today. I really do appreciate it.
Now, I know you brought a lot of photos, and we have them also here in our studio to look at. So I'll get to as many of those as we can because you gave us a stack. But for people that don't know your practice, who's the typical dental implant patient that you see?
You know, I don't really have a typical dental implant patient. You know, I guess you can put them in two categories. One patient is the patient that has, hadn't been in a while or just stayed away and has the bleeding gums, the cavities and things, and doesn't really know their options, what could be available to them. And most of these people that are coming in, they don't want upper or lower dentures. They want teeth that don't come out. They want to be able to chew and eat and do what they want to do, go where they want to do, and not, avoid certain social interactions. And then we have the other patient that, has a denture and they've been avoiding certain social interactions and certain foods, and they don't know what they can do. They want fixed teeth. They want them not coming in and out. And so we get to see both types of those patients, and they're a blessing both ways. And for these denture wearers, where they're taking their teeth in and out, in one afternoon we can put implants in where they have teeth that don't come in or out, and they're like, oh my gosh, my life has changed, and their quality of life has changed.
So how soon can they eat if everything goes right after the procedure?
They can eat right away. They start off with soft foods, and then they work up to the food that they've really missed and really stayed away from. Pizza crust is a patient I have, for example. I have a patient, she came in, she said, Doc, I'm here because I can't eat pizza crust and I can't eat steak. And she says, you know what? Can you do that for me? And she did. I was talking to her daughter yesterday, and she said, you know what? My mom, she passed away, but lived this past year. But she said my quality of life and the fact of what I could eat, what I could go and do with my husband, and eat pizza crust. A pizza crust. Most people avoid those things. She said, yeah, I could eat those. I could eat fruit. I could eat steak. Well, I don't avoid any circumstances that I can't go and socialize with my family. It's just like, oh my gosh, this is a life changer. And she was just a blessing. She was awesome.
What do they like more? Do they like what they could eat, or do they like the appearance, or a combination of both?
I think it's a combination of both. I mean, what I notice is with the appearances, that they start smiling bigger. You get the small smile, like smile. They just no smile. And then after you start putting fixed teeth in, big smile. They're not worried about teeth moving around. If you ever talk to a patient that has a denture, the teeth kind of float when they're talking because they're always trying to push it back up. And then the eating. I mean, they're like, I never knew what I was avoiding until I was avoiding it. Peanuts, pizza, steak, pork chops. They don't have to tell their significant other, hey, you need to cook it this way so I can eat it this way, because they got to play, it's kind of like a Harry Houdini in their mouth trying to figure out what they're going to eat, and how they're going to eat it, and which area I'm going to eat. And then they love having to go, excuse me, I've got to go to the bathroom when they have a social situation and go rinse out their teeth and put them back in so they can go enjoy their company. If they went out to the Mexican restaurant or something like that, and they got a bunch of food underneath their dentures. So is
this the future of dentistry? Meaning, let's say peek into the future, 20 years, 50 years, nobody will be wearing dentures. They'll all be attached to implants or something.
Oh my gosh, it's the standard of care. I mean, I think that's where it's going. I mean, I believe in it so much that I did my dad. I did my dad and I did my mother-in-law.
Really?
I did my mother-in-law. You got to have guts to do your mother-in-law on implant dentistry. I did a single tooth. She had a cantilever front tooth, which means that she had a fake tooth in the front. And she always was staying away from certain foods because she's worried it'd snap off, when she was in. They have a huge family. So we did an implant and everything. And she said, that was the best thing I ever did. Then my mom was still alive. It's a funny story. And my dad, made a denture for him in dental school. And I walked up to the bathroom, go visit him one time. And I said, it's really disheartening when I go up there and your denture's in the thing and you never wear it. He goes, oh, I wear it for social things. When I'm going out and doing stuff. And then when I did my dad. My dad was a case where I took the lower teeth out. His lower teeth were done, and put implants top and bottom and fixed teeth the same day. And my mom calls me when she was still alive. My dad's had his implants for about 18 years, and she goes, "I hate you." I go, "You hate me? Why do you hate me?" She goes, "That man's eating whatever is not attached. He's eating whatever he wants, and he's going out. We're doing this, that, and the other, and he doesn't stop. He's smiling all the time, and this, that, and the other." And I said, that was what it was all about, Mom. So, and when I started doing those cases, it was a life changer. It just made when you want to touch family and you treat people like family, because everybody comes to me, I treat them like family. It's a wonderful feeling.
Now, like you said earlier, that you could probably help the denture wearers the most, but it's hard to get them in because they don't go to the dentist anymore.
Nope.
Are there a lot of denture wearers? Let's say within 100 miles of your practice, are there a lot of denture wearers? People wearing false teeth?
Thousands upon thousands. I mean, in Kentucky and in the Midwest and things like that. I just don't think they don't know what they don't know. They're good people. They're blue chip people. They're good people. They just don't know. And that's why we're doing this, is to educate people and tell people what is out there, what you could do, because you're avoiding what you could eat. You're not going out to the Mexican restaurant. You're not going to the steak restaurant. You're not going out with your extended family. Family's huge in the Midwest. It's huge. And they want to enjoy their family. Those patients are usually older patients, and they want to have that time with their grandkids, their kids, and that's usually breaking bread. And they want to eat what they want to eat.
So would you say there's tens of thousands of people, like within 100 miles of your practice, that have an upper or lower denture?
Thousands and they just don't know. They have this.
So if it's so good, what's your take? Why aren't, if there's 100,000, and I'm sure in the state, that have an upper lower denture, why aren't they all doing this? Getting new teeth that don't come out, supported by implants.
I think they think that it's going to hurt, and we have sedation dentistry here, where we can sedate them, make them tranquil, do what they need to do, and get the dentistry they want done. We want to make sure they're comfortable and they're safe. With the COVID environment and all this other stuff that's going on, we want to make sure our patients are safe. We want to make sure they're happy and they don't feel any pain. So we sedate them in a tranquil environment. And I think that's some of the fear. And then also not knowing what they could do. You got to understand, they're walking that long dental mile. I mean, they had cavities, they had gum disease over 15, 20 years. Every time they came into the dentist, they had a bad story, a bad story, a bad story. Who wants to hear a bad story every time? And then they hear from the dentist, I got to take all your teeth out and put you in dentures. I mean, they're done. But when you can tell them, hey, I can put implants in, fix your teeth, they don't come in or they don't come out, and you don't have to worry about them coming in and out anymore. You know what? It is a life-changing moment. And they're like, is this it? Is this where I needed to go? And it
so I guess that the challenge is their fear of the dentist, and the last thing they want to do is see. I mean, look, right? People don't like going to the dentist anyway, right? So especially if you're wearing a denture, you went through a lot. Yeah. Is that what you're saying?
Yes, exactly.
So it's just a challenge to get them in.
Yes, exactly. So those patients have been going through the tapestry of dentistry. Basically, they've gotten fillings after fillings after fillings, and then a crown, then a cavity, then a root canal, and then this, and then gum disease, and all these things. And fear starts to build up because every time they come in to see the dentist or the dental hygienist, they got another bad story. And then they get all their teeth taken out and dentures in there. And then they can't eat what they want to do. But then when you alleviate that fear through rapport and connection and things like that, and then also saying, we can do this in one afternoon, give you fixed teeth, we can sedate you, you're in, and we can really change some things going on and make it for the better. They're like, that is life-changing.
What's your oldest patient that has done this? Like, how old can you be to do this?
Hey, I had a 92-year-old patient. And she was awesome.
92. Why would a 92-year-old want to do this?
Hey, you know what? I learned from her, and I'll tell you the story. It's an awesome story. She was sitting in my chair, and she says, "Doc, I bet you wonder why I'm sitting here talking about getting all my teeth out and getting upper lower fixed teeth." I said, "Yeah." She goes, "Let me tell you, my mother she was one of the oldest Kentuckians, and she lived about 108 or something like that. And she says, I'm ripping and running." She goes, "After I get this done, I'm going to Florida." And then, and then when I did her surgery, this is the funniest story. I looked at her granddaughter, her great-granddaughter. I looked at her and said, "I hear she rips and runs." She goes, "Oh, her quality of life is she eats what she wants when she's getting done with this. Is why she's doing it. And she's going to do what she wants. And she still drives. And she still does what she wants to do. And we can barely keep up with her." And I said, "You're kidding me." He goes, "No, we can barely keep up with her. And this lady's like 30 years old." and her great grandmother's 92, almost 93 years old. She's an awesome patient, and since COVID, I'm understanding she's still doing well.
So 92 years old, if they could do it, then like a 75-year-old probably gets in the chair and says, "Doc, I'm too old." So that's not old at all, I guess.
No, I think you're limiting yourself. I think it's how you see it. What quality of life do you want to have? Do you want to eat what you want to do? Do you want to go where you want to go? Do you not want to avoid certain situations? I think that she educated me. That 92-year-old sent me to class. I mean, it was a blessing.
Yeah, but what about the people that have been wearing a denture for 10 or 15 years? Isn't it true you don't have enough bone to do it in that particular case?
Hey, that's not true. I mean, there's patients that walk in my door that have been wearing dentures for 5 years, and other dentists say, hey, you can't do dental implants and have fixed teeth because you don't have enough bone. I've been doing this, been trained by the foremost in the field, people that write the books, basically, trained by them, not the person who trained them to train them, secondhand knowledge. And I tell you, there's a lot of techniques out there that we could do same day, fixed teeth, and allow them to leave with fixed teeth that same day. So it's not true. It is not true.
Now so you don't really have to turn people away and say, no, there's nothing we can do.
No, there is an opportunity for them to have fixed teeth. There is an opportunity.
Okay, you've trained.
What's that?
We talked we talked, and you've literally flown all over the U.S. to learn how to do this.
I've been everywhere. I've been to Florida. I've been everywhere in the continental U.S. searching out the best and the foremost in the field, the people who write the books, so I can deliver the quality of care that I can look and say, like I said before, I want to treat you like I treated my father and my mother-in-law, to be able to deliver that service to every patient that walks in here. That's my goal.
So no more false teeth.
No, I want fixed teeth. If you want fixed teeth, I want you to have fixed teeth. It's quality of life. Eat what you want.
Now you have this concept with your office. I guess how implant dentistry is typically done is you go to one doctor that does the surgery, you go to another doctor that puts the teeth on top, and usually somewhere else for the imaging. You do it all right there. Is that why?
Yeah, we're one of the few offices in central part of the state that has a CT scanner in Frankfort, Kentucky. I don't know if anybody else does. We do the surgery, we restore. It's all done in-house. I didn't want patients to go east of Egypt. We even have an orthodontist on staff. I wanted them to be treated like family. And to do that, I wanted them to feel comfortable and not meet new people here, meet new people. Because there's fear that drives them not to come to the dentist. And if you know those people that you come in and see, they're like family too. That they got your back, and that's what it's all about. That's why we can come here and we're all one-stop shop. Is basically you can come in, get the CT scan, get all the imaging you need, get the pre-planned. We also have a mill that we can do certain in a 3D printer. We could do this in a couple visits. Some places that take 10 months to do the fixed teeth. It just takes us a couple visits, and that makes us different. One place, one-stop shop. It allows us to really control the treatment. It allows the expedience of getting it done quicker.
So you're a dentist, so you probably think the smile is like the most important thing. How important is it?
I don't think it's not what I think, it's what the surveys say about a smile. Most people untag themselves in Facebook photos because they don't like their smile. A lot of people, hire people because of their smile. You have two twin sisters that go for a job interview. One smiles and jokes around. Guess what? That one's probably going to get hired over the other one. Also, think about the stereotyping of Hollywood. How we see people, the downtrodden, the people that aren't successful, they're missing teeth, so we really need to think about not what the dentist thinks, it's what they think and how they perceive themselves. And that is everything. Let me tell you what I've witnessed firsthand. Somebody not smiling in my chair, and then all of a sudden you put fixed teeth in it and this big old smile comes out. And then they come in, and the gals come back in the next couple of weeks checking everything. And they've got lipstick on. They never wore lipstick in the past. Guys get a haircut. They get their beard shaved. They look more, more trimmed up. They're starting to wear a little bit more dressier clothes. I didn't do that. I mean, I did do that, but I didn't tell them to do that, wear clothes or wear lipstick and things. it changes their own self-image.
You know, and we've talked about this on the phone, that people with bad teeth are judged.
They are judged,
Like,
not by me, but by society. They don't. They see it in Hollywood. You know, Hollywood sees who they stereotype. They stereotype the missing person that's a downtrodden, the one that is not successful. You know, the people that have, you know, that are possibly more successful. You know, it's because of their smile, their charisma, how they perceive themselves is an extension. And they get out more and they socialize and they go out with family and they eat what they like. It's a life changer. And I've seen it.
do people tend to get this done because of a special occasion? They're getting married, daughter's getting married, they're divorced.
You know, we see those patients in and they say, you know, I've had a life change and now I want a life change. I want my smile back. I want who I was, you know, 20 years ago. Can you do that for me? And we can do it in just a couple visits. So it's not like it's a, you know, it's a long drawn out process. They want a change. They want to make a change.
So you brought some photos. What are we looking at?
Oh yeah. Well, this patient right here, I'm going to show you here is a person that's been in my practice for about 15 to 16 years. And she came in and she said, I don't, you know, I want to save my teeth. And we talked about it. We went through gum therapy and the teeth were mobile and stuff like that. And I sat and talked to her, you know, after a couple of years, I said, you know, there are better options out there. You know, she's a grandmother, a great grandmother, and she wants to go out and socialize and eat where she wants. We break bread in the Midwest, and, you know, and she said, what can I do? I'm tired of not eating what I want. I can't go out and things. Teeth are mobile, and I've tried to keep them as long as I can. Can this fit for me? So we made her upper and lower fixed teeth, and she loves them. She comes in for her hygiene. She's smiling. She's got Facebook pictures. She's on my Facebook. She's showing me everything. She loves it.
She looks good.
She looks great. She's a great grandma. She doesn't look like it, does she?
So she can eat whatever she wants.
She can.
What about like things like nuts? Can they eat almonds? Can they eat?
That's one of the things she wanted to eat. Yeah. Yeah, she said, I want to eat
What
almonds.
about like biting? What about biting like a raw carrot with the front teeth? Is that something they have to stay away from?
They initially, yes, but after they heal, no. You can eat whatever they want. They can eat any food they want. It's like a third set of teeth.
Are husbands and wives and husbands, are they coming in to do this together sometimes?
Yeah, I mean, I've had husband and wives come in. Sometimes it's the wife, and then the husband comes after we get some implants in and we give them some fixed teeth, and then the husband goes, I know what you did for my wife. Can you do that for me? And we work them up. We talk to them about it and talk about their options. And you know, I had one. He said, I'm anxious. I want to be put to sleep. I said, that's great. We can do that for you. We can make you comfortable, safe in an environment and take care of you all in a couple of days, or well, in a couple of visits.
And with the sedation, you say some of them have very little memory of anything was done.
That's exactly right. They have very little memory. They were treated great. They feel like they were treated great. They wake up the later that day and say, did I get it done? And they had a great appointment to relax. We see them a couple of days later, and I said, how'd it go? And they said, really don't remember much. And I love my teeth. That's kind of what comes out from it.
You have another photo. What are we looking at?
This patient came in and she heard about us from Google, and she was wearing an upper denture. It had plastic on the palate. She couldn't eat certain things. She had eaten smaller bites, and she didn't want to go down the road of losing her lower teeth. She still wanted to keep those. And we cleaned up the lower teeth, and then we put implants on the top and made her have fixed teeth in just a couple appointments and no plastic on the palate. And she said, that is changing my life.
Looks very nice.
Thank you. Yeah, you know, Randy, that patient is so amazing on her before and after pictures. You can see the smile from ear to ear. She was trying to hide that smile, trying to keep the denture in place. And then you can see on the afters, that smile just opens up ear to ear. You can tell that she's getting the quality of life that she wants, and the fact that she can eat what she wants, smile when she wants to, and not worry about teeth falling out.
Is this one of those things where when it's all done and they're all healed up, they say, I should have done this years ago?
Oh my gosh, that patient that I just showed you, and also another patient I did upper and lower fixed, they said, why did I do this 5 years ago? You know, I was dealing with loose moving teeth, dealing with a denture I didn't like. Why didn't I do this sooner? Why didn't I? You know, and I say, you know, I'm here for you today, and I'm going to be here for you tomorrow. And I'm glad you did do it with me. So, the patients to say, man, I wish I would have done this 5 years earlier, and all the things I've missed out on. Those patients, when they tell me that, I tell them, I'm here for you, and I'm glad I got to serve you, but I wish I would have got you 5 years earlier, because we could have saved more teeth. And also I could have gave you that smile that much earlier, and you could have had that much earlier to eat the things that you wanted to eat and socialize where you wanted to socialize. Hey, I have another patient that is an awesome story. And I love this story because I've known her personally for about 15 years. We were on committees together and things like that. And she knew I was a dentist. She never asked me dental questions. And then she came to one of my seminars and things like that. And she came in and she says, I've got some issues and I want to take care of them. And she said, I'm breaking teeth and I think I'm on the road to a denture, and I don't want to be on the road to a denture. My husband and I, we're about to retire, and I want to go out west. And she actually just came back from out west, and we did some implants for her, and she left with fixed teeth. And at the end, it was a staged approach because she had some other broken teeth that we could save, and we staged it out. And, she's been out west a couple times. Her son just turned 24. She's an empty nester, and she's doing what she wants to do. Both her and her husband are retired. It's a beautiful thing. Hey, let me tell you about the after. With a combination of procedures, with some crowns, some implant placement, and fixed teeth, we were able to save her teeth, take her off the path of dentures, and give her the quality that she wanted, to go out west, to do what she wanted to do, all by stabilizing her teeth that we could stabilize with crowns, putting implants in where we could put implants, and fixing teeth. And she left with a new smile, a new lease on life.
Now, you mentioned at one of your seminars, so you do public seminars talking about dental implants with patients.
We do public seminars so they can meet and greet in a non-fearful environment. So they can ask me questions, what we could do for them. Have I done this before? What's my experience? What's my educational experience, and how quickly they can get it done. You want to know when the next seminar is, go to our website and you can find the times that we're doing our seminars.
We're short on time, but the two categories we talked about, people with really bad teeth that cannot be saved, that you need a full mouth of extractions. I'd like to know what their options are in your practice when it comes to dental implants. And then the denture wearer, what are their options? So take me through that process in your practice.
So Randy, one option you could do is 2 implants on the lower, okay? A full set of teeth, denture that comes in and out, that snaps in, snaps out. It's better than the alternative of a loose fitting denture, okay? It's not ideal. For a couple more implants, we can have a full set of fixed teeth that don't come in, don't come out. You don't have any plastic on the palate, so you can taste what you'd like to taste. And you can have that, you can eat whatever you'd want to eat, versus having 2 implants on the lower. There's some food debris get underneath it, you have to clean it out, versus a full set of teeth fixed with a couple more implants and nothing on the palate.
And they can eat whatever they want.
Eat whatever they want.
Now, we've got to mention this. Cost. The best dental insurance only covers a small portion. Medicare doesn't cover it. Medicaid doesn't cover it.
Yeah.
So what's the answer?
Randy, that's a great question. What I would tell you is people finance it every day. We have a person that's dedicated to financing and helping people connect the dots to allow them to get the dentistry and the fixed teeth that they want. We really want to serve our patients and make sure that they're able to get the dentistry they want to have.
So it's not like you're carrying it your own. So you have to have decent credit.
No, we are not. If they don't have insurance, we do have in-office dental plan, okay, that is for our 2 locations in Louisville and Frankfort. And but we do not carry it. We have a third-party financing company that works with us. We have a person on staff in both locations that work with the patient to allow them to get the dentistry they want.
Okay. And final message, by the way, somebody watching this, and they're in the 2 categories. They've got teeth that are bleeding gums, bad breath, loose teeth, gum disease, and they have to all be removed. That's one group. And then you've got the denture wearer. Let's say they've heard your presentation here today, your interview, but they're still skeptical. They're still afraid. They're still skeptical. What do you say to them?
Hey, come and see us. Our consults, we do a free implant consult to discuss what your options are available. We want to meet and greet you. We want to connect with you. We want to really be able to be that dentist and that healthcare provider that really helps you along the way. We want to partner with you.
So is this pretty much now like in your practice that this is all you do?
Yeah,
I know it's not a recognized specialty, but this is all you do.
That is along with my associates, that is one of the options we give. We separate ourselves. We still do the bread and butter dentistry with the associates and things like that, but we do implants and fixed teeth because patients don't know. I'll tell you a great story, Randy. I have a best friend that didn't know his options, and it was early in my career, and a dentist didn't even talk about whitening his teeth. He was doing a front tooth and didn't even whiten his teeth. You know what that told me that day? Is that I want to give patients the option. What they choose is what they choose, but I want to give them the option. And I want to be educated enough to be able to deliver the best care. All this technology we have in this office is for that same reason, to be a blessing and to serve our patients. There's one more thing I'd like to bring up. We don't charge per implant when we're talking about a full set of fixed teeth. We charge per arch. So if you need a couple more implants, I'm not going to charge you. I'm not going to nickel and dime you to death. I'm going to do as many implants I need to do to make sure the job is done correctly.
Do you think you could wipe out all dentures in traditional dentures in Kentucky someday?
I'd love to. It'd be fun. It'd be great. I mean, I enjoy connecting with people.
Look, there's more than 100,000 people in the state that have an upper lower denture. If they all found out about the benefits of getting new teeth that don't come out, there's not even enough dentists probably to even handle that many.
There's nowhere close to
people.
it. I mean, we all have to. We all have to get that training to allow them to have the best quality teeth when they do decide to do it. Because I know fear is the number one thing, and they don't know what's possible to do this. But if they come to our office and we go over the things and alleviate their fears and connect with them, I think we could definitely make a difference in their lives. In just a couple of
points. Okay, good. Dr. Peters, I want to thank you for coming on the show. Good stuff. So if somebody wants to make an appointment, they just go to your website.
Yes, sir.
Do they still get to see you or one of the team?
No, they'll see me. If they say they're thinking about dental implants and things like that, they will connect with me. They will have an in-person discussion with our team and find out their hopes and dreams, and then get an image, a CT, and go from there. Because we want to know what they want, not what I want. It's not important what I want, it's what they want, what their opportunities are.
Good. I want to thanks again for coming on the program.
No, thank you. Thank you.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.